Welcome to Prepare to Care. We're the AARP podcast that provides resources and tools to help support caregivers and their family. Good afternoon. I'm Orum. I'm your host. Good oral health is important. Not only is it vital to our complete general health, but it also helps keep our heart healthy. Yes, our oral hygiene and dental health is tied to our heart health. However, access to annual dental checkup is not something that is accessible to all. Many older adults are unable to afford the care they need to maintain healthy teeth and gums. This is especially true of communities of color. Joining us today to talk about oral health equity and disparities among African Americans is Dr. Maryam Tabrizi. Dr. Tabrizi is an Assistant Professor of Geriatric Dentistry at the University of Texas School of Dentistry at Houston. Dr. Tabrizi, thank you for joining us. Let's start with your teeth and your heart. How are they connected?
Directly. They are the same bacteria in the mouth that are found on a heart valves, especially with those with any kind of existing chronic heart issues. And massive number of bacteria, especially in a gum disease, is enough to sometimes cause somebody's heart attack.
Excellent. And dentists seem to be the last doctors that we see because we consider the dentist many times a luxury. Tell us about why it's essential to make sure that we're visiting our dentist.
That's a great question, and it is a heartache for me because you are right. Dentistry is oral health, not just dentistry. Oral health overall considers as luxury by the definition of healthcare, and that is not true because there is. What about people who don't have any teeth? They still need edentulous people, no teeth people. They still can found candidiasis infection on the gums. People with dentures, they have lesions and sores on the gums all the time. God forbid. I mean, if people have no teeth, they may be even at higher risk for oral cancer. There is just no way that we can call mouth luxury part of body where there is so much connection between this the gate into overall health.
That's an excellent tie-in to our next question, which was I was going to ask you basically about our 50 plus community and what do we see as issues that are particular to the community of those of us who are aging. So I really appreciate you letting us know about our health, our heart, and simply the aging process of the mouth. Let's get into the oral health disparities. We live in communities of color, many of us, and there are major issues that affect the finances. And do you see any factors that we need to consider because of either change in the policy issues or financial issues?
Both. There is definitely completely related in both. A lot of 50-year-olds, 55, 50 and above plus, they don't realize once they turn 65, Medicare doesn't cover oral health. And to a lot of them, it comes as a surprise when they have to buy an addition because that doesn't consider as a basic. Oral health, as much as we get older, the misconception is when we get older, we're supposed to lose our teeth. Well, we're not. It's the process of aging, and it's process of other health conditions like cardiovascular disease, heart disease, diabetes, number one, and so many other issues that can act, and so many of GI problems, stomach problems. There are so many chronic diseases that impact the process of aging in the mouth and causes to numbers of oral diseases such as like I said, caries, number one, gum disease, candidiasis infection or any kind of soft tissue in the mouth, including on the tongue. And I must say, I have to include this because it's very important. 8% of all cancers are oral cancers. And oral cancers, because usually physicians don't look in the mouth, and just for all the reasons you said, as we get older, we less and less go to see a dentist because of policy issues and money issues. The cancer lesions are usually not diagnosed and discovered in an early stage. And when they get to the late stage, the invasive treatment and then a horrible impact of quality of life is horrendous, and there is no reason for it. It's preventable, or it's treatable in the early stages. So as we get older, the more we need to see dentists and care for our oral health, the less access, money, and policy we have, specifically in a community of color.
Well, Dr. Tabrizi, we really appreciate you sharing with us today. Can you give us 3 tips in summary that will help us to stay dental and health strong? And you've mentioned so many. Which would be your top 3?
I say this top 3 is nutrition. Very important what you put in your mouth. Very important. Is nutrition, is continuous and routine oral health, and mouthwash, I say, my own opinion, is better than toothpaste on a daily base use. Sometimes if there is a lesion in the mouth, if there is a cut, burn, don't let it sit too long. It needs to be healed quickly, because as the older people tend to heal, hardest time to heal, it takes longer to heal, and healing process, when it takes too long, it can turn the cells and the tissues to something more advanced. So hydrogen peroxide rinses is the cheapest, more therapeutic rinse that you can, it can heal the small wounds a lot faster. But and policies, we need policy change, major policy change, to bring oral health as part of overall health and not a luxury, because it's not.
Excellent. So what we put into our mouths is food, advocacy, making sure we have the correct policies. And I really appreciate you sharing with us about the benefits of a mouthwash or hydrogen peroxide, because of everything that happens in our mouth. And I was not aware of that. And I hope our audience really hears that. Dr. Tabrizi, thank you for your time today.
My pleasure.
We encourage you to follow the Prepare to Care podcast on iTunes, SoundCloud, or at www.aarp.org/HoustonPTC. Thank you for listening, and above all, thank you for caring.